Welcome! I am here with Lucia, and we're doing her consultation today. Lucia is a real estate agent in an area that's kind of a little bedroom community, Willow Glen, here in the San Jose area. So Lucia, if there was something you could change or improve about your skin, what would it be?
My rosacea.
Okay. Anything else you'd like to change or improve?
Wrinkles.
Okay. Anything else?
Puffiness.
Anything else?
Neck.
Okay. Now, have you actually been diagnosed with rosacea by a physician?
Yes.
Okay.
I went to find out what it was. I thought that it was like an infection, and yeah, he told me that it's rosacea.
And did you see a dermatologist?
I saw a dermatologist just once. Then I got prescription medication through Kaiser, but it didn't help at all.
Okay.
And since then, it's not easy. So far, not treatable till today.
Okay. So, and I'll come back to that and ask you some more questions. Do you think your skin is more normal, combination, dry? How do you categorize it?
Combination.
Okay. And where do you think that you're oily?
And my nose a lot.
Okay. Do you feel like it gets real shiny, or do you have to blot a lot, or just a little bit?
No, real shiny.
Any place else where you tend to get shiny?
A little bit on the chin, but it's more where it bothers me the most is my nose.
All right. Have you ever been a smoker?
Yes.
Okay. And are you still a smoker?
No.
Okay. And how many years did you smoke?
It was always occasional, like social, once a week kind of thing. So I don't know, since college.
How long have you not been smoking?
A couple of years.
Okay. Ever a sunbather?
I'm sorry?
Were you ever a sunbather?
Yes.
Okay.
I love the sun. Not anymore.
Okay.
But obviously when I was younger, yeah, I loved to.
Okay, so like more as a teenager or? Okay.
Also my like older years, if I can say that. I love it now, but now I'm much more conscious of putting a hat and a lot of sunscreen, but I love to be in the sun.
Okay.
Yeah.
Okay, so let me ask you about the products you use. What do you wash with in the morning?
I have a treatment from Rodan and Fields, and I clean it with it's like a regimen of face wash.
Is the wash more of a gel? Is it a lotion?
It's like a gel.
Okay, it's a gel.
In the shower, I do it.
Okay, and it's kind of an all skin type gel cleanser.
Yes.
And then what do you do after the gel cleanser?
I put a cream from the same regimen that is for like to calm the rosacea, like specific for rosacea.
Okay.
Or for sensitive skins. I don't know if it's just for, yeah.
And what do you do after that?
And then I put moisturizing.
So another moisturizer after that?
Yeah, because the one before is not a moisturizer. It's supposedly to calm the redness.
What consistency is it?
It's like a cream.
Okay, so
very light cream.
Okay. And so then you do another moisturizer after that. And is there anything in particular in there that you can think of, like peptides or anything like that?
I don't have idea.
Okay. And then what do you do after that?
And after that, I put sunscreen.
Okay, is that also Rodan and Fields?
Yes.
And what's the SPF?
It's, I think it's 30.
Okay. And then what do you do at night? Same cleanser?
The same,
okay.
Yeah. Actually, at night, I shouldn't do it, but I just wipe it with those Kirkland wipes.
So you wipe it with like a makeup remover?
Yes.
And is it also Rodan and Fields?
No.
And
it's from Costco. Kirkland signature.
Kirkland.
Yeah.
So it's a Costco brand.
Yeah.
And anything that you do after that, do you do moisturizers after that, anything like that?
I put Cetaphil,
Cetaphil, okay.
the thick cream.
So the Cetaphil cream. Okay.
Yeah.
And that's your moisturizer, okay. Now, is there a reason why you do a different cream at night than you do during the day?
It's funny. Sometimes I'm very lazy to do all the process.
Oh, okay.
And I have the Cetaphil on my nightstand. So.
And actually, Cetaphil is not a bad product because it's very bland. It's made for people that have very sensitive skin. It's made for people that are very reactive. So lots of times when people are highly allergic, they can use Cetaphil. And Cetaphil cleanser is also a very good cleanser. Do you ever do anything occasionally? Do you ever do scrubs? Do you ever do masks? Anything like that?
No, scrubs no, because of the rosacea.
Okay.
But I have I use almost every day. I forgot to tell you. It's from Rodan & Fields. It's like a serum, moisturizing serum, and I put it before the
calming cream.
The calming cream, yes.
Okay, so it's a serum, and is it specifically a vitamin C serum? Is it for something in particular?
No, I can tell you later, but I don't remember.
Do you ever use a mask or anything like that?
No.
Okay. Okay. So, you were actually diagnosed with rosacea. Do you remember the medication that you were given?
No, because it was a long time ago.
Was it something you applied topically?
Yes.
Was it by any chance?
And then take it to a pill.
Metrogel by any chance?
No.
Okay.
Not that I recall. No.
Azilex?
No.
And did you take orally? You took an antibiotic?
Yes.
Okay. Have you ever had any IPL, intense pulse light treatments, laser treatments?
No.
Okay. And so tell me, are you a flusher blusher? Like, for example, do you, let's say you eat spicy food or you, glass of wine, do you flush or do you just basically stay kind of red all the time?
I stay the same all the time. And very occasionally, if I drink certain kind of wine, it could make me red, but not necessarily with the rosacea. It was even before the rosacea, because the rosacea I developed it like 5 years ago or 6 years ago. It's not from since I was I don't know, in my teen years.
So what's interesting about rosacea is that a lot of times before people actually develop full-blown rosacea, they have something that sort of is a subset or kind of pre-stage 1 rosacea, and it's where they're flushers and blushers. So you could be in your 20s, you could be maybe you're 30, and even some people in their late teens that are fair-skinned, and they have a glass of wine, they eat spicy foods, and they flush, and it'll go down to the chest area, and it might be just momentary. But what you're showing is signs of vasomotor instability, which is kind of what happens in rosacea. It's sort of, in a way, it's sort of a predictive factor. Okay, where do you think you have wrinkles?
Here's my worst one.
Okay.
And also all around here.
Okay.
Yeah.
So.
And here.
Okay, so there, and so then the crow's feet area. And what we call the nasolabial fold. Okay.
And this one is I think is the more pronounced.
Okay. And tell me about the puffiness. Where do you think you're puffy?
Sometimes like below the eyes.
Okay. And then tell me about the neck area. What bothers you about your neck?
Well, it's like very saggy.
Okay.
I would like to get rid of it.
Okay. So, first I want to talk about, I'm going to go back to the rosacea, but first I want to talk a little bit about the kind of the areas that you mentioned about fine lines. So, most of what we see in our lifetime that we look in the mirror and that bothers us when we see fine lines and we see age spots and we see all the different things that, the imperfections, about 90 to 95% of that is actually sun damage that's programmed in our skin before the age of 10. Oh, wow. And at least 50% before the age of 20. It takes 10, 20, 30 years to show up. So a lot of times when people are in their 20s and 30s, you're like, oh, gee, I'm really not aging at all. And then all of a sudden you wake up and it's like you look in the mirror and people oftentimes will say to me, oh, it looked like somebody took the air out of my face. Or I just start seeing things are moving down. And it's because it takes a long time for it to really show up. But once it does, it's like a cascading effect. It just sort of gains momentum. So the other type of that we get from aging are what is called dynamic muscle movement. So dynamic muscle movement is the crow's feet area, it's the forehead area, it's the little parenthesis lines between the eyes. If you lived in a cave and you never had any sun exposure, you get dynamic muscle movement from expressions. And what happens is it's actually a crease in the muscle. So it's muscles that overwork more than the other muscles around them. And it makes a crease in the muscle. And when you put the skin over it, it creates this line or this indentation. Now, here's good news, bad news. That's what Botox is for. Now, I'm not suggesting you run out and get Botox. We can soften that. But Botox paralyzes that specific muscle. It doesn't paralyze the other muscle, so people can still move. That's kind of a fallacy. You can't move your face if it's done right. But it completely relaxes that muscle, stops overworking, and so the line goes away. And usually it lasts for 3 months or so, and as time goes on, you get a little bit of atrophy, and that means that sometimes you don't have to have it quite as often. So just so we know exactly where we stand, because skincare doesn't replace cosmetic surgery, but cosmetic surgery doesn't replace skincare. Now, the puffiness underneath the eyes, that's something that we can have some impact on. But here's what happens. The eye area has a fat pad around it. And that fat pad is held in place. It's like a girdle with membrane and skin, and it keeps everything nicely contoured. As we age, primarily sun exposure, and you've had a lot of sun exposure. So even if she didn't, incidental sun exposure, but particularly if you've been a sunbather, it exacerbates it a lot. What happens is that girdle weakens and the fat starts to herniate through. Now, when we first notice that fat herniation, it kind of looks like you wake up in the morning and your eyes are kind of puffy. But then after you've been up for a while, maybe by 11 o'clock or whatever, it's a lot better. And then pretty soon it's still a little puffy at noon, and then it's still a little puffy at 1 o'clock. So it's more and more fat herniation. Now, there are things that we can do topically to help with the appearance of that, because there are things that can kind of act a little bit like a diuretic. And also the fine lines that are down in this area, not the crow's feet, we can soften them, but the fine lines in this area, we can make a big difference with that. So we can make the eye area look a lot more contoured, but realistically. And we can also help with things like dark circles. Now, the neck. This is another area. So what she's talking about here is the platysma muscle. And, actually, before we get to the neck, let's talk about the nasolabial folds. Anyway, okay. So one of the major aspects of the aging process is loss of volume. And it's estimated that about as much as 50% of what we perceive as inevitable aging is loss of volume. So when faces are volumized, the highest point of the face should be the cheekbones, and it's also the widest point. And cheekbones, by the way, are the most feminine feature of the female face. And then you should narrow down into a well-defined jawline. As we age, the cheek pad moves down because you lose volume, and primarily one of the major factors in volume is hyaluronic acid. So you have lots of hyaluronic acid when you're born. That's one of the reasons why babies look so fat. It's not that they're really fat, they're just full of hyaluronic acid. When you get into as you age, you lose it, but particularly when you start getting into your 20s, you really lose hyaluronic acid. So that's why injectables are so popular. So the cheek pads move down. As they move down, this area flattens and it creates a nasolabial fold. It also, as the cheek pad moves down, the female face becomes more masculinized. That's why oftentimes when people live together for years and years, they say, oh, gee, the man and the wife just start to look alike. And men become more masculinized as well, but for them, we expect them to look masculinized. So that's volume. Now, again, these are some of the things that topically, the appearance of, we can improve it to some extent, But realistically, that's why fillers are so popular and facelifts and those kinds of things. The neck area is another area where you have a fat pad and you have a submental fat pad in this area. And the platysmal muscle, which is the big muscle that they pull up with a facelift. When people think about facelifts, and I used to think the same thing, I used to think, what do? They just kind of start up here somewhere and just pull everything up. But actually, a facelift is really a lower facelift, and it's the platysmal muscle. So that's what they're pulling up, is this whole area here. As we age and the platysmal muscle pulls down, the fat begins to herniate. Okay. Kind of like it does in the eye area. Also, we start to see what's called necklace lines, so the texture changes in the neck area. Now, we actually have technology that can really help with the appearance of that. In fact, if you go to our website and see the before and after pictures, which were taken very carefully, this is not faked, you can definitely see a difference in lessens the look of that. And the appearance of it, and the necklace lines are softened dramatically. It can make quite a difference in the appearance of that area. So, we'll get to that. In general, I want to go back to the rosacea, because this is really your primary concern. So, rosacea, typically the onset is between the age of 30 and 50. And it's a disease of vasomotor instability. So it's a chronic inflammatory disorder. Blood vessels are designed to expand and contract, expand and contract. In rosacea, they become compromised. So the characteristics that we see, which is the redness, and I'm assuming if you look in the mirror and you look closely, do you see dilated capillaries?
I think so, yeah.
Okay. Because that's the defining factor. You can have redness, you can have bumps, but if you don't have the dilated capillaries, you don't have rosacea. And I have seen a couple of situations where somebody presented just like rosacea, and when they weren't able to get anything that really helped to relieve the appearance of it, the doctor finally did a biopsy, and it turned out that they had an allergic reaction to something.
Oh, wow.
And it was something that they were using on a constant basis. They'd used it for years, because you can still be allergic to something you've used for years. You can develop a reaction. And so just keep that in mind. Now, the other thing with rosacea is that it is a disease of reactivity, not sensitivity. So oftentimes it's categorized as sensitive skin. People treat it with products for sensitive skin, which sometimes can make it a lot worse, and you're not really using things that can really help with the factors that are involved with rosacea. So reactivity means that you can be reactive to different triggers. Your trigger could be wine. Your trigger can be spicy food. It can be sitting in a hot room, humidity. It could be, some people it's avocados, it's berries. It's just, you just don't know. And in secondary rosacea, as it progresses, you can get what's called secondary lesions. Now, it looks like acne. And rosacea used to be called acne rosacea, but that's an incorrect term, because rosacea and acne are two completely different diseases. In rosacea, when you get these lesions, they're from inflammatory causes. It may look just like acne, but there's no microcomedone, which is what is involved in the acne process. So as a result, sometimes people find out they can have these inflammatory lesions one day, and then all of a sudden the next day, maybe they're gone for a while, or they're so much better. And they can kind of come and go. But when you get into a more aggressive stage of rosacea, you get these inflammatory lesions. So it's an inflammatory disorder. Now, there's all kinds of theories about rosacea and what causes rosacea. And it's such a complex issue. Number one, we know sun exposure is a major causative factor, because in fair-skinned people, the sun has an effect on your blood vessels, passive dilation, blah, blah, blah. Blah, blah, blah is a medical term, by the way. Anyway. But what we now know today, that the primary issue in rosacea is something called the kysoleucidin protein. Now, this is an inflammatory protein, but it's a protein that we actually produce, and it's a good protein because it's a factor in mediating wound healing. So when you cut yourself, you burn yourself, you want to produce this protein. But if you're just producing it all the time, you're sitting in a hot room, or you're just producing it for no reason, it's a major factor in rosacea. So it's one of the things that we have to take into consideration when we are dealing with the redness. And this is something that's actually fairly new. And so that's one of the things we're going to take into consideration for the appearance of your rosacea. And the more anti-inflammatories we can use, the better off we are. Things that are considered to be sort of anti-inflammatory in nature for the appearance of rosacea. So here's what we're going to do today. First of all, we're going to put you on what's called our basic skincare management system. And I'm writing. This is, first of all, one of the questions that I'm always asked is how can we all be on the same system but maybe be on it for different reasons? Well, one of the reasons is because there's a product in here called BioClear. And BioClear is a combination of glycolic, salicylic, and azelaic acid. Azelaic acid is actually sold by prescription for rosacea. It's sold by prescription for acne. When you put it together with glycolic and salicylic, it is one of the best things I've ever seen for the appearance of resurfacing the skin, for the appearance of rosacea, mild to moderate acne, all of those common skin concerns. And it also is the best resurfacing agent because it makes the skin just look so much more, the texture of the skin looks much more flawless, poreless looking, just incredibly smooth and reflective. And you know, I always say, it's not that when we have oily parts of our skin, it's not that we want our skin to look dry. We want it to look dewy, not shiny. We want it to look glowing, not oily. And so that's kind of what it helps to do, is to give you that really nice, beautiful glow. And there's other things in here. Glycolic acid has been shown for the appearance of rosacea, even medically, to have a tremendous effect. It's excellent for that. So there's glycolic acid in here. There's a liposoluble vitamin C, which is also very good for that, with something called dimethylaminoethanol that helps with the contour and the appearance of contour. There's also a wonderful hydrator, and there's a sunscreen. The sunscreen is really critical. When you have rosacea, I don't care if you're just going outside to get the mail, you need to be wearing a sunscreen. Sun is definitely a trigger with rosacea. So the sunscreen is really, really important. It has to be broad spectrum. Now, in addition to that, I'm going to have you using Rosaleaf, and I'm looking here for my Rosaleaf. Here we go. And this is going to be a major factor with the appearance of rosacea. Okay, puffy eye, Luminate Eye Gel, my favorite eye product. And finally, I'm trying to remember here, oh yes, okay, the neck, Juvenec. And again, if you go to our website, I don't even need to get into a lot of information on this because a picture is worth 1,000 words, and you really can see a difference in the appearance of the neck, the appearance of contour. You know, so many neck products are just essentially the same type of creams you put on your face. This really does have technology to assist in addressing that area. Yes. Now, here's what I want to emphasize. So today what I'm doing is I'm kind of addressing basic concerns, but we're going to continue to work with you because somebody's going to check back with you in about 4 days. I'm going to check back with you in a couple of weeks. And this is so that we can make certain that the program that she's responding to it, and also that if we need to make any modifications, if we need to just fine-tune something, which normally I don't have to. But in addition, even if you tell me a month from now, you say, wow, my skin's the best it's been, we can actually make it even better.
Nice.
So we'll continue to work with you. And I have to say, you know, rosacea is a very tricky, very complex issue. I've always said I can line 10 people up, 9 of them might do really well, respond really well to a program, and number 10, I don't care what you do. So it will be very hopeful, and let's see how your skin does.
Yeah,
do you have any
great.
questions for me?
How do I use it?
We'll go over that.
Okay.
We will go over that.
Okay.
Anything else that I can answer for you?
No, I'm just excited because what if it works for me?
Yeah, I'm excited too.
I want to be one of the 9.
And so please, number one, I have a YouTube channel. I think I mentioned that before. I just started the YouTube channel. I do consultations on the YouTube channel, which is what you're watching right now. And please, please, please subscribe. Thank you so much for viewing. I'll see you later. Bye.